You're listening to Online Pet Health Podcasts with Dr. Megan Kelly. Continuing education for veterinarian rehabilitation therapists. Learn more at onlinepethealth.com.
Hey Vet Rehabbers, thank you so much for taking the time to listen to the Veterinary Rehabilitation Podcast. Click the subscribe button so you get notified every Wednesday when I release my next episode. To all of you that come every single week to listen, thank you so much for your continued support. I appreciate each and every one of you. Today I'm chatting with veterinarian Lynn Hendrix, and she changed from traditional veterinary to becoming a palliative veterinarian doing home visits. She works together with veterinary rehabilitation therapists to make pets' last days and months as comfortable as they can be. Lynn spent a lot of time studying human hospice, and she extrapolated that information that she learned into her veterinary career. Before we head over to that chat, if you've not already, please come and join us on our Facebook communities. We have 4 small animal vet rehabbers, hydro vet rehabbers, equine vet rehabbers, and our business vet rehabbers. So this is the place where vet rehabbers hang out online. We share research, tips, and advice, and it's a great supportive community. We'd love to have you online there with us. If you're interested in doing some vet rehab specific online webinars, you can sign up to our free membership, and you can go to onlinepethealth.com/free. So over to my chat with Lynn. Hey Lynn, thank you so much for joining me.
Well, thank you for having me. I'm grateful for being here.
For the listeners, Lynn, won't you tell us about yourself and how you got interested in palliative medicine?
Well, I am Dr. Lynn Hendrix. I am a passionate early adopter of veterinary palliative medicine, and I'm a house call vet in the U.S. I got into palliative medicine really because my mother passed away in 1993, and that was my first experience with human hospice. And I thought at the time it would be very important for my 2 young kitties to have a better end of life than what I saw in the clinical setting when I was an assistant. So, and they were young at the time, but I was looking forward in their lives. And so I started studying human hospice kind of shortly after that. I started looking into what we had available to us in vet med, which was in 93, 94, like 0. And it wasn't until really 1998 that I found Dr. Eric Clow, who lived on the East Coast, who gave the first national lecture on palliative care. So that kind of led me into vet school in 98, and I kind of went to vet school saying I was interested in animal hospice. And then life happened. I became an emergency doctor because there were no palliative doctors, and got burnt out on emergency medicine, and then sort of decided to switch my life around and started doing house calls. And it was just sort of a natural progression of what I did.
Yeah, because if I think back to vet school now, we didn't really get any training on it at all. Nothing at all. I can't think of anything. And interestingly, I actually did veterinary nursing first. So before I did veterinary science. And maybe I'm just forgetting, but I don't remember anything in the veterinary nursing course about that too, which one would think would be covered, right?
Well, we don't, I mean, it's an interesting thing, because every veterinarian does it, birth to death or some aspect of that birth to death. And so we get trained from birth to death, but that, just like in human medicine has been really reluctant to get into palliative care and palliative medicine. And so, it's been kind of a progression. And even in my book, I talk about it being a spectrum of care rather than, a new thing. It's not new in that we already kind of do it, but it's new in that we are expanding upon what we can do for end of life care. So that's how I see it. It's kind of a big difference in that it's just an expansion, just like internal medicine, I'm sure, was when it became a specialty, and cardiology was when it became a specialty. Like I'm sure veterinarians were like, why do we need cardiologists? We already take care of the heart. But they expand upon it. They learn more. I probably know more about death and dying than your average bear, and so or vet. And you can ask me pretty much any question about death and dying, and I can go into long diatribes about things.
So if you look at the word palliative, I looked at a definition of that, and that is relieving symptoms, right?
Right.
So looking at your practice and where you come in, like where is the time when you're called in a dog that maybe has a chronic illness, or maybe it's just an old dog with arthritis and multiple things, so not actually something, for example, a sample like diabetes or something that is actually, that we're actively treating. Maybe it's a dog that is 14, 15 years old. It's osteoarthritic, but otherwise generally healthy.
Right.
What is the point that palliative care actually happens? Is there a point? I mean, can we say like from now on we're doing palliative care? Like, how do you measure that?
Love that question. So one of the things that I can tell you is that in human medicine, there was a landmark study done in 2010 by Jennifer Timmel and her group. She's a human oncologist who also specializes in palliative medicine. So they did a study where they took two groups of lung cancer patients, and they put one group into palliative care early, they put the other group into palliative care late, which it was very typical in 2010 that people would go into palliative care right at the end of their curative medicine disease, process. Both groups got treated the same. They both got radiation. They both got, chemotherapy, all the curative type medicine that they do. And here's what they found out. They lived better if they went in early than if they went in late. That's not surprising to me at all, because palliative care is also about comfort and support. But the thing that they found was that the people who went in early, and lung cancer has a fairly short course in humans, they live 3 to 6 months longer. And
Wow.
that's significant.
Yeah.
For especially for humans, but I also find that to be the case for animals. So the earlier you can get an animal into palliative care, the better. Doesn't mean you're not going to do, the chemotherapy, the radiation, the heart failure medications, etc. It means that the family has more support. They know what's coming. They know when to kind of switch gears and move away from curative medicine as we ramp up the palliative care. And so the earlier we can get them in, the better, and the longer they will live. And I have a personal example of this, and I know it's anecdotal and an outlier, so I have to say that. But I had a patient who was in stage 4, or what they would call stage 4 in humans, hemangiosarcoma. He had tumors on he had a bleed. He was I think he was a 12-year-old American bulldog, 100 pounds. I mean, easily. He was a big boy. Had tumors on his spleen, in his liver, on his lymph nodes, and in his lungs. Diagnosed at the university that I live nearby, and they told them he has probably a month or less. Right. So they took him home, found me, called me in. We started him immediately on pain management and, just symptom management stuff. And this was years ago. And so I didn't even know what I was doing. I mean, I was just doing what I knew what to do. And I figured, well, I'll get a call in a couple of weeks and we'll go down the euthanasia path. And I didn't hear from them for 3 months. And they called me and said, can we have refills on our meds? And I was like, what? Wait, how's he doing? His name was Benny. How's Benny doing? And they said, oh, he's been doing great since you were here. I'm like, Okay, good. Yes, you can have refills, and we did that every 3 months. I would see him every 6 months. So he lasted about 20 months. 19 and a half of those were good months. The last 2 weeks, he started to decline. His tumors didn't significantly grow, at least the splenic mass, which I could feel for, most of that time. He had very few bleeds. And so he would swim, which was lovely for his osteoarthritis that he had. So he did really well in that time period. Yeah.
Amazing, absolutely amazing. So what are the common types of conditions that you would see in your practice? I mean, cancer is obviously the most obvious one.
Right. So I see chronic progressive and terminal illness, chronic progressive diseases such as degenerative myelopathy and dementia, osteoarthritis. Oftentimes they have osteoarthritis, and then they have other things that have been called to their attention. Cancer is the most common thing that I see, and that is true for human hospice as well. But I see organ failures, I see dementia, degenerative myelopathy, those sort of things. Sometimes I see a frail animal that doesn't have a specific disease, but is just kind of withering on the vine, so to speak.
So when you come to the homes, because obviously you travel, which is great for the owners, because a lot of these cases are, they're not well, and putting them in the car and them traveling is not great for them. When you get there, what are the strategies that you look at to try and help the animals, number one? And then, of course, it's the people too, because I think that a lot of the support is supporting the people, because they've got loads of questions. And sometimes I think in veterinary medicine and in practice, we're so busy, maybe we don't have enough time to actually support the clients adequately through whatever their pet is suffering from or going through.
Well, I just gave a lecture on VIN, kind of about these kind of strategies. It could be a whole nother podcast about just strategies for palliative medicine. But we do a lot of pain management, we do a lot of symptom management, and so I try to keep up on the drugs available, the newest techniques in rehab and things. I'm not a rehab vet, but when I was when I was studying for my book, I realized how important rehab is. And so I also, try to incorporate other people in the community, other veterinarians who are doing various things. So it's complex and complicated about all the things that I do, and it depends on the disease process, involved. So those are the kind of basic strategies of what I do. We support the family. My appointments are 3 hours.
Wow.
And so, like, you're right, I just gave this podcast, or the VIN lecture, and I talked about, you can't do this in 15 minutes. You can't do this in a 30-minute appointment. I recommend at least an hour for people to try to have these conversations, if not 90 minutes or 2 hours. I started with 1 hour back 12 years ago when I first started doing house calls. And I don't know, one of my first patients went an hour and a half and was still following me out to the car, asking me questions. So then I made it 2 hours, and then I was still having people follow me out to the car asking questions after I gave a 2-hour presentation. So I expanded it to 3 hours so that I could get all their questions answered in the time period that we had.
And when you obviously doing these consults, you come and you see the patients regularly. Are you the vet that they call eventually when they make the decision to euthanize, or do they generally call the vet that they've been using?
So in general, they call me because they want a house call vet, right? They want somebody to come to the house. Occasionally I get somebody who wants to go back to the regular vet, and that's okay. I want that animal and that family to have support in the best way that they feel supported. So if they want to go back to the regular vet, I am totally okay with that. I do on occasion, especially back when I didn't have a team of people and doctor, team answering phones and doctors. I did do things all on my own. And so occasionally I wouldn't be available because I can only be in one place at one time. I'm not magic. And so I would have to refer to other veterinarians, or, they would have to choose another veterinarian just because I simply wasn't available. For my palliative patients, I always tried to be, but, I can't be available at 2:00 in the morning because I'm sleeping. So part of that issue made me develop a crisis plan for people so that they knew what to do in a crisis situation where it was 2 or 3 in the morning and something drastically changed, because as we all know, if you've ever done emergency, it always drastically changes at 2 or 3 in the morning.
Oh, and on the weekend.
And yes. Well, I worked 7 days a week until I hired my first doctor, and then I could take a occasional time off, but I did work 7 days a week. I didn't work 24 hours a day, but I was available 7 days a week.
So I love that. So you basically give them tools, because in that moment when things start going bad,
Yeah.
often what happens to people is they just don't think. They don't know what to do. So you give them a plan that says, okay, we prepared for this. And they basically go to whatever that plan is, and they say, this is what we need to do. So giving them the tools to be able to handle that situation. And I guess a lot of your work is preparing them for the emotional components of the decision that has to happen. And that's one thing I think about in my vet rehab practice. I mean, I did do it when I was practicing as a normal vet, but it was a conversation that often came up when I was in vet rehab is, when do we make that decision? When's the time? Like how do we know when the time is to put the animal to sleep? How do you handle those situations? And what is your advice to clients when they ask that question?
So I am unique. I will just preface it with that in saying that I think it is not my decision to make for clients. And so what I help clients do is understand the progression of the disease so that they can make a decision that is best for their family. And whether that is an early line in the sand or a late one, whether that is, we wait for the first seizure to happen or not, we go, because I take 3 hours in having these conversations, we go through all of that. We go through, what that looks like. And I have developed my own advanced directive. And it's sort of, we would like to see our animal be able to do this. We don't want to see them go through that kind of questions. What kind of medical procedures would we be interested in doing if things changed, or things are going well, but I had one that broke a tooth. Things were otherwise okay, had cancer, blah blah blah, but it broke a tooth, and so they opted to do you opt to go and get the tooth repaired? Do you opt for euthanasia at that point? So I think it's a complex and complicated and individual decision, and so that helping people understand what's going to happen with the disease, but also help them make decisions for themselves. The other reason I like using my advanced directive is because it has also what's going on with the family. Are they getting enough sleep? Are they eating? I had one person one time who didn't eat because she was constantly preparing meals for the animals and not for herself. So I'm sure she was like eating a little bit as she was, preparing soups and things for she had 2 dogs in palliative care. And I'm like, you can't, you need to eat. You need to take care of yourself so you can take care of them, because if you go in the hospital, who's going to do it? If you're not sleeping through the night, who's going to take care of these pups? So helping people understand how to take care of themselves as they're going through this process. Caregiving is hard. It can be 24/7, and some people are dedicated to that, but they need sleep just as much as anybody else. So I know that I didn't answer that question directly, but it's not a veterinary answer also, and that's why I said I am unique.
Yeah, so I'll share with you how I used to handle those situations. And I used to say to them to write down on a piece of paper 5 things that they think is quality of life for their pet. So not for anyone else's pet, for their pets, because every dog is different, every animal is different, what they enjoy. And then they basically put that on the fridge. And as soon as they lose one of those out of the top 5, they'll scratch it off. And when they get to a point where they've got 3 or less than 3 of those quality of life, then I used to say to them, and then it's time to start thinking about it, because then what have they got to live for? And I must say, for me, especially in vet rehab, we have such a different relationship with clients and our patients compared to vet medicine. In vet medicine, you see them for such a short period of time. And, in vet rehab, you might spend an hour with them and you're massaging them, doing exercises with them. You create a very special bond between you and the patient, and as well as with the clients, because you get to spend so much time with them. They're actually, if I think about my clients when I had my practice, everything about them, when their daughter's getting married. And although sometimes in vet medicine, I had that, it was on a different level, in vet rehab. And I used to just know myself, when that dog used to come in. And for me, in my own personal animals, I've known from a look in their eyes when they look at me, I just know that it's time. And some of my patients would have that look, but obviously I was not able to tell them that, because I can't make a decision for the clients. But then when I saw that look, then I would say to them, we need to revisit that quality of life. Let's have a look at your list and let's have a look and see. And I used to write it down. So in the beginning, when they first came to me, I'd write down those 5 qualities. And then when I was thinking it's starting to get to that time, I would bring it up again and say, let's go through, have they got this? Have they got, and then we usually come to a decision, or they would come to a decision with my help. But it's so hard, isn't it? I mean, I just wonder for you, how does that, how have you managed your own emotions? And compassion fatigue is something that's so real for veterinarians. And, I think that as vet rehab therapists, we have it a little bit, but I think that we don't deal with death as much as veterinary, as vets do. When I had my vet rehab practice, I wasn't euthanizing animals, and we had to deal with it. But it was a slow process. It wasn't, dealing with death like we did in veterinary medicine. But for you, every single patient, is going that way. I mean, at least in vet rehab, we get to see the 6-month-old puppy or the 1-year-old dog with hip dysplasia, You're just seeing all these older patients suffering, and obviously you do amazing work to help relieve their symptoms. But how do you protect yourself from the emotional aspect of what you have to deal with? And is there a technique that you've got, or are you just one resilient veterinarian?
Well, um, I would say that I've done a lot of personal work on myself. So I can say I don't know that I'm any more resilient than anybody else. I still feel guilty when people call at 2 o'clock in the morning and I don't answer the phone. But what I really focus on is not walking in their shoes, but walking next to them. So
Mm.
walking this journey next to the person. I mean, to me, death is a reaffirmation of life. So it's shown me things like what is important in life. You know, because I'm walking this journey with these people. You know, what do they focus on? What do we focus on for the animal? We're trying to help that animal live better as it's going through a dying process or as it's going through its elderly stage. And being able to not only share that with clients, like you said, you're sharing an hour and you're doing that more frequently than I am sometimes. I'm sharing 3 hours and then follow-ups and things. So, we really do get to connect with people, and those connections are deep and meaningful, especially around death, because that is a universal human issue. We all are going to die someday. And one of the things that it's shown me in my own life is what's important in life, and not focus so much on the death, um, and helping animals have a beautiful, gentle death is just as significant as everything else we do, and being able to hold those hands and walk that journey with people, even if it's for an hour. You know, I have made such a significant difference in those folks' lives that, they will see me outside of their home, walking down the street or whatever, and they will come and talk to me. And my daughter used to go, well, who's that? And I'd be like, I'm pretty sure I saw them at some point, but I don't know, didn't always connect
Yeah.
until they told me who they, who their animal was. It makes such a significant difference in people's lives to be able to walk that journey with them. So and I will tell you a quick story about writing 5 things down. Um, I had a client one time who said, well, my vet said to do that. And so we did. And we got down to number 4 because they said, call us when we get to number 3. And then we rewrote a new list.
Just the quality here changed.
So, and I find one of the reasons I use my advanced directive and it kind of came into being is because because of that guy who said, and it wasn't the first, it's not the first time I've heard people say, well, we got down to number 4 and 5 and they still seem to be doing okay, so we just threw that out.
Yeah.
And I think it's because people write that list with the expectation that the dog is going to behave like they did when they were 2, as opposed to behaving like they should be behaving when they're 15. Nobody, that's like saying, well, write a list of things you like to do when you're 20. And now that you're 80 or 90, oh, well, it's time for you to go, because you're not doing what you did when you were 20. So it's that's the perspective of clients, is
Yeah, it
that
doesn't
you
always
know,
work depending on the
right.
client.
I want Fluffy to chase the ball. I want, and then they're 15, they have degenerative myelopathy. They're not going to do that. But can they sit in the sunshine? Yes, maybe they could, enjoy that or hang out with the family or, whatever it is. So I just kind of shift focus of what's important to those people, instead of having them just write down 5 things that they think are important, because they're not thinking necessarily about the dog being 15 or
Yeah.
whatever.
So you got to put that into perspective for them. One of the
Yep.
things you said now made me smile because it reminds me of myself. You said you didn't really, when you saw the people on the road, you couldn't really put the connection until they told you what the dog's name was. So I was like that in practice. It is dreadful. I could never remember the owners. But you put the dog in front of me and I knew exactly what the dog's name was and everything about it. And I think it's because that's where we focus, right? We focus so much on the animal. And I would also meet people and then I'd just say, what's your dog? Oh, yes. And I'd call it by the dog's name and then the person's surname, so
Right.
Fluffy Jones or whatever, that's the name of the dog, so, oh yes, Fluffy Jones. So I know exactly who that is and who you are now.
I think it's also that we're so focused on what's going on in the moment, and then you see them out of context.
Yeah.
And
I think you're right. That's
harder. Harder to, at least in my brain, I can pull up to somebody's house and go, I've been to this house before, and then the memory just comes flooding back. We were in the living room on the couch, we were playing ball with the other dog, blah blah blah. I mean, I have that kind of memory, but it's seeing them just walking down the street. But the thing is that you make such a difference. You make such a difference in that hour.
They remember you,
or, that they remember you for sure.
Yeah, that's special. So Lynn, what role do vet rehab therapists play in palliative care?
Well, I kind of alluded to this earlier. I think that rehab should be primary player, especially in early palliative care, that we can get these animals who have OA, who, have degenerative myelopathy, even dementia patients. In human medicine, dementia patients are in physical therapy, early. The more weightlifting they do, the more things that they do, the better, the easier the dementia goes for them. So it's for chronic progressive disease, I think that rehab is huge. But I'm not a rehab vet. So what would you say would be, how would you treat a congestive heart failure patient? Because they almost always have comorbidities that affect their musculoskeletal system.
Yeah. I mean, you see, that's the thing, is that we don't really get referred those type of cases. So, and I think only when we are in that multidisciplinary team where you're in a practice that has surgeons and medicine specialists and veterinary rehab therapists, and we're all under one roof, those are the patients that actually get that all over care. And, I've done a lot of interviews with vet rehab therapists from all over the world. And if I think back now, those are the ones that get to see those pulmonary cases, or, they're doing physio-type treatments on those type of cases. Whereas in general vet rehab practice, the type of cases that you're going to get referred to you are going to be musculoskeletal cases, so the neurological cases. But like you say, there is such a place for what vet rehab therapists, and I think also, and I'm sure you cover a lot of this too, but vet rehab therapists are very trained in how to modify the environment for improved mobility. So doing a house visit, looking at different surfaces and how they're moving, giving advice on how to get your dog up and down stairs and in and out of the car, and lifting up the food bowl. There's so many things that vet rehab therapists, are so, because they're constantly thinking about movement and how that can be easier for the animal. And I think as a dog gets older or as a dog gets weaker, all those kind of things just become even more important. Something as simple as putting rubber matting where the dog's bowls are, so that their feet don't slip outside, raising the dog's water and feed bowls. So there's so many things that vet rehab therapists can do. And I love the fact that you chat about working together with other specialists and other people, because I do think it's a team approach to these kind of cases.
Yeah, absolutely. It absolutely is. And I think that's one of the things that rehab folks could be doing, not just for the musculoskeletal neuro cases, but,
Yeah.
I mean, I think OPH posted tripods and how that rehab could help with the tripod cases. And I reposted it in my Facebook group and got a lot of kind of pushback on, well, we need to be amputating these dogs or cats because they're cancer, blah, blah, blah. And I'm like, yes, I agree with that. And we could be doing it better. We could be rehabbing them. We could get prostheses on them so that they're more, aligned. And I think there's a need for us to recognize that there's always ways that we can do things better. And I think that's where rehab comes in. I think that's where palliative medicine comes in, is that because I focus on evidence-based palliative medicine, and we don't have a huge evidence base. We need a huge evidence base, and we're not there yet. Part of my book writing was to make suggestions about things that smarter people than me could go and study. Here's what they do in human medicine. Here's what we do in veterinary medicine. Maybe we want to look at, does the human medicine, whatever aspect, work and for our veterinary patients? How could we modify it? Things like that. So I think that we can always do better. And I think that's where palliative medicine and rehab kind of walk hand in hand with that, especially in those earlier cases. If we can get in on the earlier cases, these animals are going to live better. Their families are going to live better because their animals are living better and they're happier. And who doesn't want that?
For sure. And then tell us about your book, and if the listeners are interested, where can they get it from?
Well, I'm based in the US. You're in South Africa. So it is available all over the world at the Book Depository and various Amazons. My book is Animal Hospice and Palliative Medicine for the House Call Veterinarian. But my tagline is, it's not just for house call vets. There's some aspect of it because the publisher wanted the tagline for house call vets because that's a hot topic. But I wrote the majority of it for every veterinarian to learn more about palliative medicine and how they can do things better and look at things in a different way. Because as I said earlier, I'm unique in that I see things differently than a lot of vets. There are a few. I mean, I do have colleagues around the world who are interested in this care and learning more in other various ways. So I am just an early adopter of it. So that's my book. That's where you can get it. Amazon, if you have Amazon, the Book Depository, and they have it on sale right now. The Book Depository was on sale the last time I looked at it, which was not too long ago.
Awesome. So for those of you that are interested, I will put the link in the description of this podcast. Lynn, it's been so lovely chatting to you. Thank you so much for your time. And so interesting. And thank you for being an early adopter, and thank you for being someone who's looking after these owners and these pets in their time of need. So we appreciate everything you do.
Thank you. Thank you for having me. And I appreciate all the rehab vets out there. Talk to me. help us walk hand in hand together. And help these animals live better. Yeah.
Love it. Thanks, Lynn. Take care. Bye-bye.
Bye-bye.
If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. Now, don't forget to bookmark our next Vet Rehab Summit. This is on Friday the 10th and Saturday the 11th of November. Come and be a part of the world's largest online veterinary rehabilitation conference created specifically for you, the vet rehabber community. Online Pet Health members, you get VIP complimentary access to the Vet Rehab Summit. For more information about continuing education for vet rehabbers, you can go to onlinepethealth.com.